Okay,
Let me get it started.
all right. All right. Okay, all right. Okay, that's fine.
You don't have to call me if there is. I don't want to put this on today.
Hello, folks. Thank everybody for being here. All right, let's see here. All right, good afternoon, folks. It's time to start our press conference today. Again, I want to thank the panel that is with us today that discuss COVID-19 protocol, and we're going to get some updates as the numbers nationally are starting to increase. I know that schools are starting to reopen, so I think it is important that we have community leaders come together once again to talk about how their departments will be handling the COVID-19 pandemic. With us today is Mr. Scott Stevens, Overton County Health and Rehab, Ms. Shannon Cantrell, Livingston, Overton County Chamber of Commerce, Mr. Ben Danner, Overton County Executive, Mr. Andy Langford, Overton Health Department, Overton County Health Department. With him, his assistant, Ms. Jenny Cottle, Overton County Health Department, Ms. Penny Kirby, Livingston Regional Hospital, Dr. Donnie Holman, Overton County Schools, and Ms. Ann Stamps, Del Hollow Mental Health. Did I get everybody? Chief Greg Etheridge is in attendance as well. First, we will go ahead and get started with Mr. Andy Langford from the Overton County Health Department, and joining him would be Ms. Jenny Cottle from the Health Department as well. Come on up, Andy. Thank you.
I'm Andy Langford. I'm the Director of Overton County Health Department. I want to thank Mayor Hayes for allowing us to come back here after about a month break and give some more information on where we are with COVID-19 here in Overton County, give an update from the Health Department viewpoint. We've been doing this now several months, and we want to maybe try to put a fresh spin on this because we have new information and things that we feel is important to the public. We want to make sure that everyone understands this and processes the best they can. So right now where we are in the state of Tennessee, on July 15th we had 873,403 cases. On July 28th in Tennessee we had jumped up to 891,331 cases. So we've seen us go from about 5,000 active cases in Tennessee to 16,000 active cases in about a 13-day, 2-week period. The total cases in Overton County, we were at 2 active cases in Overton County on July 15th. As of July 28th, we're now at 23. We've been here over the last few months with very low numbers of active numbers in Overton County, and now we're starting to see a gradual rise as we thought we would here with the Delta variant. So an increase of 21 cases in the past 2 weeks, that's about 1,000% increase in cases just in Overton County alone. This is a trend that you see across the state. We're seeing it here in Overton County. Also though, in the United States, we are now sitting at about 66,000 daily new cases, taking a 7-day average of where we were last week. Compare that where we were before, 7 days previous, we were about 40,000. And if you look back where we were on June 19th, about 11,000. The thing that we're trying to point out to everyone is that we're seeing a rise once again a surge, and the thing that is important to realize is this, about 80% of the cases we're seeing are the Delta variant, which is a much more stronger virus, attacks in different ways. I'm going to let Jenny talk a little bit about that as one of our RNs at the health department. But this is a new strain, and it is a dangerous strain. We've seen this pattern before. We've been through this pattern before. I've stood at this podium and I've said over the last several months, we've seen cases in big cities, we've seen cases, but we've not had any cases in Overton County, and I would sit and say, it's just a matter of time. It's just a matter of time. Well, as we see these cases rise up, and if you watch the news, you'll see some of your more metropolitan, your bigger cities, they're starting to fill up the hospitals once again. We don't want that here, but eventually we're going to see more and more of this Delta strain here. It is much more infectious than the strain we had before. It affects the body differently, and is a dangerous thing we're dealing with. So we've seen the pattern of urban to rural. We're going to see it again. It's coming. I hope that it's not as bad as what we dealt with before. I'll say that the one thing we have at our disposal is vaccines. And so I want to focus a little bit on vaccines here and what we have in Overton County. That is the one tool we have to fight this. And we recommend the vaccines, and we're here to help and give that vaccine. We've given about 12,152 vaccines here in Overton County. Approximately 28.65% of the Overton County population have received at least one dose of any manufacturer. We've got about 26% have completed the series. That's either Pfizer or Moderna. So we have this tool here available to us. Many people have said, I want to see what's going on. I want to wait and see. The vaccine has been available since about December. We're looking at 7 months. I want to see how it affects people. I want to see. We know it is an effective tool. We know that right now what we're seeing is about 90% of hospitalizations, 98% of reported COVID deaths are occurring in people that have not been vaccinated. We know this vaccine is effective, and we have it at the disposal to give it every single day. So it's a free vaccine. We have it here at the health department or at your physician's office, many places you can take it. We ask that you, if you've thought before, I think I'll wait and see how that works. I think I'll wait and see what is going on with that. I think I'll wait and see if they get more information on that. Please do your research, but I also ask you and tell you, it is an effective vaccine. Any side effects are very minimal compared to what could happen to you if you get COVID, especially with this new variant that we're dealing with. 2 doses of vaccine similar like Moderna or Pfizer are about 94% effective at preventing symptomatic COVID-19. There are breakthrough cases. You'll hear about breakthrough cases, and people will say, well, I took a vaccine and still got COVID. But in the majority of those cases, it's a very, very small percentage. And those people who had the vaccine did not present with specific or very harsh conditions. They were asymptomatic many times. They did not require hospitalization or result in death in the majority of the time. At this time, a booster vaccine is not available, so we don't know where that's going to be going in the future as well. But we do have the Pfizer and the Moderna. So COVID-19 cases, hospitalizations, and deaths are once again increasing in nearly all the states. It's fueled by the Delta variant, which is much more contagious than past versions of this virus. The high spread of cases and serious outcomes such as death and hospitalization. It's happening in places with low vaccine rates. Low vaccination rates are where you're seeing more of your red on maps or different things. That's why we would like to make every push we can to encourage people to get a vaccine here in Overton County to protect yourself, but protect your loved ones as well. So here at the Overton County Health Department, we continue to offer free COVID-19 vaccines Monday through Friday from 8 to 4:15. We have the Pfizer Vaccine, which is available for children aged 12 and up. Children must have a parent present for vaccines. The vaccine is a 2-dose series administered 21 days apart. That's the Pfizer vaccine for children. We have the Moderna vaccine available Monday through Friday also for anyone 18 and older. That vaccine is a 2-dose series and it is 28 days apart, but both of these vaccines work the same way. So we're there, we're not, we're working with people. When you come in the door, we can get you in and out within 10 to 20 minutes very easily. You fill out some paperwork, you get your vaccine, we'll give you a vaccine card, give you an appointment to come back within so many days, either after 21 days or 28 days, and you're out there. We are also continuing testing. Right now we're focusing on vaccine, but I can tell you that we're seeing our testing numbers go up, and we're seeing more people come for testing, more people having symptoms, and more people that are coming for testing are positive. We test Tuesday and Thursdays from 8:30 till about 11 o'clock. And then we also have self-test kits on Monday, Wednesday, and Fridays all day, and on Tuesday and Thursdays in the afternoon. We're still focusing and trying to make our main focus on vaccines, but we're still here trying to give that service of testing as well. I'm encouraged that over about the past week to 2 weeks, we've seen more people coming in for vaccine. There's an appointment system you can get on to the State of Tennessee website, or you can just come in. I hope that people know that they can come into the health department. Just walk in anytime and we'll take care of you. We'll get you a vaccine. But I believe that we continue to just let everybody know and educate the public. We're there. We want to vaccinate as many people as we can. And we're starting to see more people come in for vaccines compared to where we were back when we were doing 100, 150 a day, 200 at times. We dropped down to where we weren't doing many at all, trickling through. It's starting to pick back up again. I want to tell everyone, please, if you have questions, you want to get more information about the vaccine or anything in general with public health, please contact us at the Health Department. Our number is 823-6260. We're also right off the Radford Hicks bypass, across from Food Line, next to the ambulance service. Drop by any time. We'd be happy to answer any questions. Thank you very much. And
I do have some questions about masks and folks that have not had the vaccine and folks that are having that have had the vaccine. Where are we at with mask requirements?
I'm going to ask Jenny to come up and speak to that as well.
Come on up, Jim.
I will tell you that in the health department, we're a medical facility. We're wearing masks. CDC recommendations are that we wear a mask in our facilities, and we'll continue to do so. I believe that there's still probably information out there that they're studying, but what we have seen is that they are recommending people wear a mask. We are providing guidelines from the CDC and the Tennessee Department of Health to agencies. We're working with them, trying to work in conjunction with them. It is, I believe that there is possibility that even if a person has been vaccinated with the Delta strain, there are ongoing studies, but you can possibly, that's what's so scary about it, a vaccinated person who has the Delta strain can spread it, and it's much more contagious. This Delta variant is than the previous strain, they liken it to the chickenpox. So I know masks are a touchy subject. That is a personal decision. We at the health department, though, as a medical facility, will be wearing masks. And if anyone comes and wants to talk to us about it, we will be giving out the CDC guidelines for mask wearance on that.
Thank you.
So my name is Jenny Cottle, and I'm one of the nurses at Overton County Health Department. I was just going to talk a little bit about the COVID Delta variant. Okay. Sorry, thank you. The difference between this variant and the other variants is that it is 30 to 60% more transmissible than the other variants, which means one person infected can spread it to 6 other people or more. The other thing that is different is that once you get infected with it, it does the same thing in your body where the variant just goes crazy and it makes you sicker faster. So your symptoms could come on a lot quicker. You could get a lot sicker with it. They are finding that people that are vaccinated, symptoms are less and they are less likely to be in the hospital. So again, recommendations would be to go back to making sure you're washing your hands, hand sanitizer. If you have symptoms, self-quarantine. And then of course, recommendation is to wear masks when out in public. But again, that is a choice. The other thing was definitely to be getting vaccinated. We at the health department are here to help you with anything that you need, so you can give us a call. Andy gave you our number. We just want to make sure that you stay healthy and safe.
So I have a question, ma'am, about folks that are vaccinated, wearing masks, or less likely, or equal as likely as folks that have been vaccinated. I know that's a crazy question, but I'm just wanting to hear.
Less likely to get infected?
Yes.
Is that what you're asking? If they're wearing masks?
Yeah. If you have been vaccinated,
Okay.
your chances of getting the COVID or this Delta is more slim, perhaps, than even without wearing a mask?
Well, and you heard the numbers where people with who have been vaccinated with both vaccines, 2 weeks or greater out, are less likely. What would you say? 93% less likely to get infected. Now there still is that small percentage, so that's why I know the recommendations that I have last seen still recommended people with vaccine that had been vaccinated, if out in public, to wear masks.
Thank you.
Thank you.
Okay, thank you very much, Mr. Langford and Ms. Caldwell. Thank you so much. Next, we will have with us Dr. Donnie Holman, Overton County Schools. Dr. Holman.
Thank you, Mayor Hayes, for having me here today. It is time for school to begin, that's for sure. I'd like to tell the people of Overton County that we have been working hard this summer to prepare things for school to begin. And we have I have a plan, a rough draft plan, you might say, of what we're going to do to have a safe reopening. We want everything to be as safe as we can possibly make things for our students and our staff. Here's just a good time to say this, that when students come to school, our first priority is always safety. After the safety is taken care of, then we will teach them all we can. But student safety is our top priority, always has been. What we're planning on doing for this school year is all schools will open for in-person learning following the regular daily schedule. Multiple layers of protection already in place will continue. For example, sanitizing stations and water bottle filling stations will be used. We're enhancing our cleaning protocols, increased hand washing, and we are also going to continue our somewhat limited visitor protocols that we had last year. We're going to keep that in place as well. Masks will not be required, as they discussed. That is a touchy subject. but those who wish to wear them will be respected and allowed to do so by all means. Anyone exhibiting COVID-19 symptoms should not report to school and should seek medical guidance. Isolation and quarantine protocols from health officials should be followed. In the event of a positive COVID-19 case in one of our schools, we will follow the CDC and the Tennessee Department of Health guidelines, and parents and guardians will be notified of their child's possible exposure. Overton County Schools will continue to monitor COVID-19 rates in the schools and collaborate with state and local officials for guidance as necessary. And one more time, student safety is always our top priority. We want to do everything that we can to see that our students are safe, and we sure hope to have a great school year this year. Thank you, Mr. Hayes.
Thank you, Dr. Holman, thank you. Next, we have with us from Livingston Regional Hospital, Miss Penny Kirby.
Thank you, Mayor Hayes. We continue to strongly encourage our team and the community to become fully vaccinated. As you've heard with everyone, there is significant evidence that becoming vaccinated is safe and effective. We continue to carefully evaluate the research and the levels of COVID-19 activity in our community. We continue to evaluate our processes within the hospital, and this includes visitation. We are currently open for visitation, but we do require our visitors to answer screening questions at the front desk. There is a temperature check as well, and masking is mandatory in the hospital for visitors. And that's the same with our staff. Our staff are wearing masks in the clinical units. We are testing each patient upon admission for COVID-19. This testing has proven for us to be able to give better care for our patients and keep our other patients and our staff safe. We also have advanced cleaning and disinfection protocols. The team at LRH, their maintenance and infection control, continue to work diligently to make sure the touchable surfaces are consistent and clean and disinfected. Thank you, Mayor.
Okay. Thank you, Ms. Kirby, for the great update from Livingston Regional Hospital. Thank you. Next, we have Overton County Executive, Mr. Ben Down.
Thank you, Mayor Hayes, and thank everybody. You know, it seemed like it wasn't a year ago we was here, but it's been a long year. I mean, we had a few cases, we had hundreds of cases. When we first started this, the only tool we had to combat COVID was masks. You know, we didn't have the vaccine till later. I personally, I got COVID and I was wearing a mask. I don't know how good the masks work, but I think the vaccine works really good. I had the vaccine. I would just like to recommend everyone, you know, the bad part is we've had less than 7, out of 10 people. I mean, 3 people out of 10 is all that's had the vaccine in Overton County. I mean, so the majority of Overton County has not had the vaccine. I hope that you don't get the COVID. I've had it. I know a lot of us here have had it. It's bad. I hope the people that didn't get vaccinated do not have it. But I feel like that's the best tool that we've got is getting vaccinated. And that's, like masks, that's your choice if you want to get vaccinated or not. But I feel like you're protecting your family and everyone around you if you get vaccinated yourself. So I feel like, everybody needs to do that, which we're, as a county, we're not going to mandate masks and make you wear masks. We're not going to mandate vaccines and tell you have to do that. But I feel like it's in your best interest to do that. So that's all I've got from the county. Thank you.
Thank you, Mr. Danner. Next, we will have Mr. Scott Stevens, Overton County Health and Rehab Center. Scott?
Thank you, Mayor Hayes. I'm Scott from Overton County Health and Rehab Center, and with our county positivity rates climbing here in Overton County, we have to reinstate some safe practices in Overton County Health and Rehab that we had went away because our positivity rate had went down. So starting today, We continue to offer private visitation by appointment only, and you can call us at 823-6403. However, whenever you call to make an appointment, we're going to ask if you have been in contact with anybody that has COVID in the past 14 days. Even if you've been vaccinated, if you've been exposed to somebody with COVID, we're going to deny that visitation. So make sure you're honest with us and let us know if you have been around somebody with COVID. Also, starting today, all of our staff at Overton County Health and Rehab will wear the mask and now the addition of the face shield. So the face shield had went away, they're back now. Everybody's 100% wearing a face shield. So if you have an indoor visit plan with your family, we'll ask you to wear a mask and a face shield. If you would rather not wear a face shield, then you can visit outside, but you'd still be required to wear a mask. Let's see, so weekly testing is another thing that's come back for our staff at Overton County Health and Rehab. If you're not vaccinated, we're going to do weekly testing. And that's until hopefully we never have a positive case, but if we do have at our facility, then everybody vaccinated or not will resume testing weekly. Let's see, so our board that shows how many days we've been COVID-free at Overton County Health and Rehab is at 233 days COVID-free. So that's all I have. Any questions? No? Okay, thank you guys.
Thank you, Mr. Smith.
So next, we will have, let's see, Miss Ann Stamps, Hill Hollow Mental Health.
Thank you, Mayor Hayes. I just wanted to remind everyone that we are seeing clients in person at Del Hollow Mental Health, 501 Spruce. Our first-time appointments are still being conducted by phone. You can call and get one of those at 1-877-567-6051. All crisis services are still available 24/7. The adult crisis number is 1-800-704-2651. Children's crisis number is 866-791-9223. Suicide Prevention Lifeline, 1-800-273-8255. Just want to remind folks that are uninsured, that we may have an opportunity to provide services for you through the state's Behavioral Health Safety Net program, or also our COVID-19 Behavioral Health Grant. You can ask those questions by calling that first-time appointment number at 877-567-6051. If you come to our office, please expect to get your temperature checked and have some screening questions, and we are asking all clients to please wear their mask while they're in the building, as we're wearing our masks as well. So as Dr. Holman said, it's time to start back to school. So I thought I'd just bring a few tips on starting back to school. It's really important for our students to have a routine, get up at the regular time every morning, go to bed at the regular time every night, have time to do their chores, regular meal time. Sleep is extremely important for our students and our kids, so it's real important to have a regular bedtime routine. We're going to turn off all those electronic devices and try to rest and relax and get calm and get some sleep. Feel free to talk to your kids about starting back to school, especially if they've been in a virtual or a hybrid situation and now we're going to go back in person, and there may be some folks that are masking and some aren't. So just, talk to your kids, ask them questions. If they're nervous about something, do your best to find answers for them. You can certainly, I'm sure, can call the Overton County School System with any questions or concerns that may relieve some nervousness or anxiety in your student. Other thing is trying to develop some healthy homework and study habits. So we want to try to create an environment that's conducive to that, where it's quiet, there's not very many distractions. Also want to try to put your kids on that kind of a schedule that we're going to use this time for homework and special projects, and then save this time for free time. And if you notice that your student is struggling, they may show some signs of depression or some anxiety or some nervousness or fearfulness about going to school, don't hesitate to call the school, the teacher, homeroom teacher, the counselor, or even your healthcare provider to get some assistance for your student. And Mayor, that's all I have, unless you have any questions for me, sir.
No questions, Ms. Stamps.
Thank
You
you,
do a good
sir.
job as always. Thank you. Next we have with us is Ms. Shannon Cantrell from the Overton Livingston Chamber.
Thank you, Curtis. I wanted to just share a quick report on the unemployment rates and our sales tax data for the last couple months. As y'all know, the pandemic unemployment benefits ended on July 3rd. Many of our local businesses are still hiring. You can go to jobsfortn.gov to see those in our area that are hiring, or indeed.com. There might be a larger list there for you to choose from. Our current numbers for June of 2021 were at 5.1%. We are up from 3.9 last month. Currently, we are the third lowest in the Upper Cumberland. And on our sales tax revenue for locally for us right now, we are at 11.6% up. Now this time last June, we were up 25.6. So the fact that our sales tax is remaining, continuing to rise, that is a good thing. Our local sales tax revenue is extremely important to our community, and we urge each of you to continue to shop local, and we appreciate those who do. That's all I have.
Thank you, Ms. Cantrell. As far as the city's report, I've heard enough information here today and nationally to make effective immediately all city employees that have not been vaccinated will be required to wear their mask. All folks effective immediately entering City Hall will have their, or any city building will have their temperatures checked and be required to wear a mask. For the folks that have been vaccinated, it will be optional for those folks to wear their mask, but we will go back to the, all employees will have their temperature checked at the beginning of each shift, and we will start that effective immediately. Is there any questions for me? I want to thank you again for everyone for coming out. I think it is so important that we keep our community informed on exactly kind of what's going on and what directions that we are going. I think that the folks in this room have definitely made a difference in Livingston and Overton County, and I continue to for folks to tell me that they appreciate these press conferences. Our next one will be September the 13th at 12 noon at City Hall. Thank you all, everybody. Have a safe trip home. Thank you.
No, I tried that. She got a whole bunch of stuff she had to get done.
Thank you.